1 in 5 patients mentions a language barrier as an obstacle to access healthcare, according to the French National Authority for Health. Hi everyone, my name is Samah Ghalloussi. I am a data scientist specialized in natural language processing with a degree in health information technology. Communication problems have an impact on the quality of care, and the language barrier can have a serious impact on the patient's well-being. According to a Canadian study, a patient who doesn't speak the same language than the caregiver has a 70% greater chance of being admitted to hospital. Admissions decrease when an interpreter is present. However, professional interpreters are not always available, and their cost is quite high. 25 to 30 euro for 15 minutes of interpreting. Our innovation is about bringing together in a single tool the medical knowledge of several languages and dialects. The solution we offer is a medical voice assistant that instantly translates the doctor question into the patient native language, taking into account the medical context as well as the patient's culture. Our service is available on smartphone via an app and is aimed at healthcare professionals. So now we will do a live demo. So imagine you are coming to France and you need to see a doctor for an emergency. As you know, French doctors don't speak English very well. But it is not a problem anymore because your doctor already has the app AALIA.Tech on his smartphone, and he will now be able to talk to you directly. So I have the app on my phone. So first of all,
souhaitez traduire en anglais, je vous écoute.
So I am the doctor, so I will say, pourquoi êtes-vous venu aux urgences?
Why have you come to the ER?
And then I will say, so the patient will say, I have a pain in my back.
J'ai mal au dos.
And then after that, the medical doctor will say, sur une échelle de 1 à 10, où situez-vous la douleur?
Can you assess your pain between 0 and 10?
So this is the last screenshot, as you can see here. And so we have currently more than 600 medical sentences translated in several languages and dialects. And our solution is available 24/7, so no more waiting for interpreter services. Also, there is no need for a third person during the consultation, so that communication is only between the caregiver and the patient. Privacy by design, we have thought in advance about the protection measure to be implemented in order to be GDPR compliant. So our business model is a SaaS, so software as a service, and this is our team. So we are 13, and we have a medical board. And this is the organization and enterprise companies that are supporting us. Thank you.
Thank you very much, Samah, and you're also being right on time. No worries with the technical issue. So do you have any questions from the experts regarding this pitch? Okay, so maybe I'll give some time for the experts if they have a question. So Samah, oh, we have Eugene, of course. Please go ahead.
Thank you for your presentation. I wonder if you have any study, it doesn't have to be a scientific study, that's been done among the practitioner and ideally patient to assess how feasible or how acceptable it is for them to use this technology to translate our conversation?
So first of all, we have to know we did a survey to know what how do the doctors how do they are able that what solution they use to when they have a patient that doesn't speak the same language than them, and what they do is some of them are using Google Trad today. So this is why we know most of them are doing when they don't have money to have a real interpreter, because this is more a solution more for hospitals. What they do is that they use something like Google Trad. But what you have to know is that Google Trad is not made for medical context. So sometimes you will have error in translation because of ambiguities in in the context. And this is why we think that AALIA.Tech will be a great help, is because most of doctors that use technical apps are already doing that with something that is not adapted for their problem, you know. So I will say I don't remember exactly it's like when they don't use they don't have someone to help them to translate, they will use Google Trad, like 60%, something like that.
Great. I guess my question is more about, do you have any data or experience from the end users? Could it be the doctors, nurses, or could be also a patient who you have piloted the app? And do you have any testimony and feedback from them?
Yes, we do. We have some of our doctors are already using the app with their patients. So, for example, the Dr. Najat Hadi, she lives in Morocco, but she's from France. And now she has a lot of patients from Moroccan Arabic background, and as she doesn't Arabic very well, she used our technology to be to deal with patients that doesn't speak the same language than her, and she also used the app for English and for Norwegian. And the app is on beta test on the test flight, so it's beta testing Apple Store. And even if you want to download it and to try it, you can do it. I will send you the invitation.
Thanks, Samah. I think we have 2 questions for you in the Q&A, so I'll just pick one of them and you can answer the other by writing. So I think one is asking if the app works fully online, or does it have an offline database? Can it work offline, or it has to be connected to the internet?
For the moment, to be able to use it, I have to send an invitation, or as I showed you, I don't know if you see the beta link, the beta test link. You can also use this link and to be able to have the beta test. So for the moment, it is closed to it's only available for the beta tester.
Well, I understand that it's on the test flight. I understand this. I think the question is related to the app itself. Does it have to always be connected to the internet, to online, to be used, or so it doesn't have like an offline database or version of it? Okay.
Yes, for the moment, we have to have the internet connection to be able to use it. But what we want to do in a near future is to be able to have a mode that will allow a medical doctor to use it even if they don't have internet. But it will be a next step for us.
Yeah. Okay, great. I also, actually, I think we can go for this last question that I find here on the Q&A. So it's actually asking, how strict do we need to be with the questions to get the correct translation? So do we have to use specific words or like specific sentences to get a correct translation? And do you have other languages other than French to English?
Yes, we have.
Add to that question, it's a very similar one. You have 60 plus languages. That's a hard thing to do technically. How do you pull that off? And can it be used in African languages?
How we did that? First of all, you have to know that it is only being enriched. So even if we have 600 sentences, some of the language are just at the beginning of the whole translation, and some of them are completely translated. And we have Arabic dialects, so Tunisian, Moroccan, Algerian, Egyptian, Lebanese, and Saudian for the moment. We also have Spanish, so a lot of language from European continent, but for the African continent, we have some of them, but not all of them for the moment. But what we aim for is to have as more as possible of languages, because as the system is made to be able to we just have to bring to have information, and for that, what we are developing is that we are currently developing a platform to help interpreters to add more and more translations in their own language or dialect, so that we will be able to propose even the most rare dialect to help a patient understand the caregiver when he's not in his country.
Exactly. Thank you very much, and it's a great presentation, and thanks again. And I think now it's a good time to remind all the experts and judges to just put their scores in the digital scorecards, as we say. And also, I would like to ask them for like a very quick final remarks, maybe like 30 seconds, less than 1 minute each. So if we can start maybe with Marta. Marta, if you have like just a final remark regarding the session, what we're doing, Innovation Factory, anything you want to say, anything that you saw that you like or disliked. Yeah.
I'm here, and I just prepared my post for the LinkedIn with my impressions from this panel. And I just wanted to say that that I really had the privilege to be in this panel and in this jury to select top global innovators among the SMEs. I have seen excellent AI solutions that are ready to, let's say, fight the pollution of the air and water and waste management, and of course to support patients while they need medical help, and to fight the fake news, if I can sum it up. So basically, but if we focus on the planet and on the solutions that that are fighting basically the pollution, I just wanted to sum it up in a saying that there is a way, definitely there is a way to save the planet if we just open your eyes and embrace the technology. Thank you.
Thanks, Marta. And maybe I'd ask for another comment from Alex. Alex, just final remarks or comment?
Yes. For me, it's just been really incredible to hear all the solutions that have been being built around the world. Like, these kind of people are the ones that make me proud to know that I had a hand in building AI and making it possible, and that people are using it to solve grand challenges that will reduce suffering around the world. I'm really excited. I can't wait to use some of the applications. The translation one, I would love to try it out and see how it works. Good luck to all of you. You're all winners in my eyes, and I look forward to interacting more.
Thank you very much. Bruce, final comment from Bruce?
So from my side, I just want to thank all the startups and founders for taking the time to pitch and coming into this public forum. As a founder myself, I know how much work you put into this idea and the technology and to get adoption. So kudos to you, and thank you very much.
Thanks, Bruce. And Jijen, any final comments or remarks?
I always like receiving invite to be a judge on the panel because it always surprises me to see what people are working on, what challenges they are trying to solve with technology, and today is no exception. And I think in addition to everyone have said, I really like the platform that are trying to promote the use of AI for social good, for achieving SDG, and really applaud for all the innovators here that are trying to work in the space that have a social impact. As I've been working in healthcare, so obviously I'll leave more comments down for the last presenter, and just some experience from working with healthcare provider and patients and how to promote healthcare startup. We can reach out separately if you want. Yeah, but I really encourage to continue on.
Thanks very much. I think this is the main purpose of this, to make this kind of connections afterwards. And I'm sure there's a lot of startups that I got already some interest from you guys that you want me to connect you with, and we can make this kind of connections afterwards, and hopefully it's going to lead to a proper deals or partnerships. That's the whole spirit and the aim of the Innovation Factory.